Good, happy Tuesday evening, December 15, 2020. I'm Riley King, and welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's begin. First up, we're going to begin with COVID-19 updates. New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 31,875 number of people in New Hampshire have tested positive for COVID-19. 13,688,504 number of people in the United States have tested positive. 604 number of deaths from COVID-19 in New Hampshire. 862 number of people have been hospitalized with COVID-19 in New Hampshire. And 302,67 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 852. And let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 5314. And now let's take a look at these three charts here. Let's start with the first chart here. Total cases, total positive COVID-19 cases in the purple, total hospitalization in the orange, red deaths in blue recovered, and these are total cases. And now let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases and current hospitalization. Let's take a look at this chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases, orange, new hospitalization, and red deaths. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here. Age group of cases and female and male of cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. First COVID-19 vaccination administered in New Hampshire. Frontline healthcare workers receive vaccine at Elliott Hospital. Let's take a listen to that video from WMUR News 9.
So I really wanted to get a gift for my boyfriend that was about spending time together. Flavia is the perfect gift for the both of us to share.
Mike, it really was. There were some tears at the event today. These healthcare warriors who have held the hands of dying patients in ICU and relayed loving words from family members from underneath layers of PPE for 9 long months are so tired and so relieved that protection in the form of a vaccine is finally here. 5 vaccines were administered to frontline nurses on the plaza. The inoculation event conducted in freezing cold conditions and was filled at times with silent anticipation that pivoted to joy and gratitude, a collective feeling that while there are still long, sad weeks ahead in this public health crisis, Governor Sununu told the crowd, "This day marks the beginning of the end." The very first nurse to get the shot as a 17-year veteran at the Elliott, who has seen so much suffering and death over the last 9 months, who is exhausted and says when she was asked to go first, did not hesitate. Here's why.
I said from the very beginning I would be first in line. We're all exhausted. We work very long shifts with very, very sick patients. The units are all short-staffed for various reasons. People are out with COVID. They have to quarantine because they have family members with COVID.
Now, there are vaccines in the state right now earmarked for long-term care facilities. Those facilities will not be able to start vaccinating until December 21st. According to HHS officials, that has to do with the agreement that they signed with the federal government to administer those vaccines via CVS and Walgreens. We're live this noon. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Nashua health officials ask city to impose curfew on bars and restaurants. Public health director says curfew could help limit the spread of COVID-19. Let's take a listen to that video from WMUR News 9, Andy Hirschberger.
It's the Sale of Sales savings event featuring Chevy employee discounts for everyone at Bentley Chevrolet. Buy a new 2021 Chevy Silverado 4x4 double cab pickup, Bentley Chevrolet, the neighborhood dealer who treats you like family.
With Nashua's COVID-19 numbers skyrocketing since November, the Board of Health has unanimously approved a recommendation that all bars, nightclubs, and restaurants in the city close at 9:30 at night.
We felt that it was really important for us to look at what other measures could we take to protect our community, which is a border community, right over the Massachusetts line.
Nashua Public Health Director Bobby Bagley says recently they are seeing as many as 100 positive cases of COVID-19 per day. Hospitals are feeling the strain, and they felt something had to be done.
When people drink alcohol, it tends to lower their inhibitions, and when people's inhibitions are lowered, they also lower their mass. You might talk louder, you get closer together, and those are all risky behaviors that allow for increased exposure.
The proposal will now move to the Board of Aldermen for approval. Bagley says they're not trying to punish these businesses during a very busy time of year. People can still get takeout and drink and dine before the curfew, and they're hoping to get the community to work with them.
We need to stop this virus so that people are not dying, so that families can see, another holiday, see graduation, see weddings. When you lose family members, you're losing the opportunity for those things.
Bagley says they are trying to schedule an emergency meeting with the Board of Aldermen to discuss this proposal. Andy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. Exeter police take pledge to strengthen mental health training with a goal of improving interactions between police officers and people suffering from mental illness. The Exeter Police Department has become the first in the state to take a pledge through the One Mind campaign. Coronavirus forces all Concord schools to remote learning update. Infections outside of the school setting and quarantining are causing SAU 8 to move nearly all the district's students to remote learning. Nearly all of Concord school students will be moved to remote learning later this week, according to Kathleen Murphy, the director's interim superintendent. The decision was made Thursday to move the remaining schools in SAU 8 district to remote learning due to the number of quarantined teachers, administrators, and students, and the lack of education staffing to teach children in the classroom, she wrote. Broken Ground Elementary School will remove to remote learning on Wednesday, while Christopher Coliff Elementary School will change learning models Thursday. Concord Regional Technical Center students will move to remote learning on Thursday as well. All winter athletics will also be put on a pause beginning Tuesday through January 4th at that time. The decision will be reevaluated, Murphy said. The instructions will be delivered using the remote model employed in the fall. 4 days of synchronous teaching per week, she said. Remote learning will be in place until mid to late January. The remote learning plan also includes special education students and English language learners and students that the state told school districts they had to ensure were not falling through the cracks. This decision, too, was difficult one for Murphy to make, she said. I'm still trying to get kids in, she said. It's really based on if I have the staff, resources in some schools. It's working in other schools. It's difficult. The district received more confirmed coronavirus infections information Tuesday, including 2 students at Millbrook Primary School in grade 2, cohort A, who was last in the school December 7th, in grade 1, cohort B, who was last in the school December 8th. A Millbrook bus driver who last drove students on December 7th was also infected. 2 CRTC students were confirmed positive to, and they were last at the school on December 11th. 2 Concord High School students and a staffer were also infected. The students were in grade 10, cohort A, and last in the school December 7th. And grade 12 full-time was last in the school December 8th. The staffer was last in the school also on December 8th. The district believes that nearly all coronavirus positive cases connected to the virus outside of school settings, she said. According to the state's data and dashboard, the district has only 4 cases connected to the school setting. 28 cases have recovered from the virus. Concord reported 376 active cases on Monday, the most since the pandemic started. While less than 1% of the city's population infectious have grown significantly 3 weeks ago, there were 93 cases. On November 4th, there were 54 positive test results in Concord. About a third of the 376 cases in New Hampshire state prisons for men. Many others are in long-term care facilities and other institutions in the city. But the spread is also in the general population, too. More than 1,100 people have become infected in Concord since the pandemic started on March 1st. We hope that the guidelines provided by CDC and New Hampshire Health and Human Services will serve as a reminder as we deal with the increased rate of COVID-19 infections, Murphy said. The districts hope to return to hybrid instruction on January 19th. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your evening. I'll see you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.